The origins of the Wisconsin Partnership Program are an impressive story about a couple of really visionary leaders who drove the process. Blue Cross Blue Shield in Wisconsin wanted to convert to a for-profit entity. The leadership of the state and Blue Cross Blue Shield came together and felt that they should give back to the people of Wisconsin with the mandate that those funds would be used to advance the health of the people of our state and in communities as well. Now, for that to happen, it really took leadership and drive at the very top levels, and doing it in a way where the strength of academic missions of research and education were focused on practical implications for making a difference in the lives of people throughout the state. There was a remarkable vision by my predecessor, Dean Phil Farrell, to use that gift as an engine to drive change such that our medical school would transform into the nation's first school of medicine and public health.
The funds were really directed 100% towards the public interest, which was unique because in other states, only a portion of the equity value really went to the public, and our core function is really about consumer protection and making sure that the insurance industry in Wisconsin is regulated in a way where consumers are protected. The way it was done in Wisconsin was really a testament to the commitment of supporting public health and ensuring that the funds were used in the public interest.
The Wisconsin Partnership Program reaches across the entire state. We go into rural areas, inner city urban areas, tribal communities. All 72 counties across the state of Wisconsin are touched by our programs. So we are a true actualization of the Wisconsin idea that communities and the university walk hand in hand in partnership as we move health forward.
Not every state, as a matter of fact, I'm not sure there are many states at all that have a similar structure that allow this type of grants to go out, that allows this type of community health to be supported. We're fortunate that it's set up this way. We're fortunate that there's been such fantastic interest in this. And as a result, we're seeing the massive success that we've seen over the last 20 years.
The WPP grant helped us to tap into how can we really impact Black men's health by reaching men from a location that they trust, that they respect, and they can be themselves. And so we knew early on that if you really want to reach men from a location where they trust, they respect, and you got to come to the barbershop, because all of the data indicated they're not going to the doctor. And so we decided, let's bring the doctor to a location where they're at. WPP saw our vision, and this is why we're here. They saw our vision to do better, to do more, and now we're a beacon for the nation.
Farmers are 3.5 times more likely to die by suicide than people with other careers. That's obviously had a major impact on our rural communities, not just for the families, but the ripple effect into the communities themselves. The funding and supports actually helped us when it comes to helping those farmers and farm workers in our communities. We're making it possible for people to have harder conversations. Working with WPP has made some things that feel impossible or unreachable possible.
Farming is such an individualized pursuit. So much of your identity is tied up into how you raise animals, how you care for the land. It's a level of individualization that just simply does not exist in other industries. When you put your identity into the products of your labor, it's not necessarily about how much you get paid. It's about the gratitude. It's about the feeling of purpose and accomplishment that you get out of it at the end of the day. The more that people get involved and the more that people understand that the way that you interact with somebody literally is a life or death conversation. I mean, it can literally save a life how you interact with somebody. The thing that was most valuable for me was recognizing that it's not that difficult. I mean, I'm not saying it's easy, but it's with a little bit of training, it goes a long way to literally save a life.
We have received a substantial grant from Wisconsin Partnership Program and some other funders to open up our own dementia daycare program for Latinos here at the United Community Center. None had existed before that. Up until that time, our Latinos in our community were not being properly diagnosed or were even hesitant to go seek help because they would be sent to these large hospitals, large clinics where nobody spoke Spanish, and they used interpreters. So that's not a good way to do an assessment for dementia. And with the funding from Wisconsin Partnership Program and other funders, in 2007, we opened up the Latino Geriatric Center. With the current grant that we have from Wisconsin Partnership Program that started in 2022, we're now expanding that into a regional model. So to me, to see the work of an organization like the United Community Center, the opportunities I have here, and the support and the belief from somebody like WPP just really re-energizes myself, my staff, to continue doing the work that we're doing.
The African American population has had very low breastfeeding rates and have not had access to breastfeeding services and people of color who are lactation experts. I discovered that there were both doulas and birth workers in the community, but they were not coming together and having discussions and building community and collaboration. So we created the Community Doula Initiative, and the Wisconsin Partnership Program funded that particular program. We created the first doula directory in the city of Milwaukee. We provided training for the doulas in different areas. Partnerships and funding really matters, and the African American Breastfeeding Network is better off and has gained so much from the Wisconsin Partnership Program because of the early beginning and the funding that we received with our initial doula-assisted birth grants.
The way that we've been able to use Wisconsin Partnership funds is to really expand the idea that physicians have roles with groups of patients, with communities, and that they're not only responsible for individual health, but responsible for the health of a community and a population. And that shift in the way of thinking was really helped by the utilization of these funds for us to be creative, get consultations, try things that would have never been possible with our traditional funding of medical education.
From day one of medical school, we're really able to show our medical students how it fits into practice regardless of the field of medicine that you choose. The other neat thing that we were able to kind of add to that is a health equity lens to that quality improvement project. So they were thinking about not only how does this improve quality of care in that practice, but also ensuring that that quality of care is happening in a way that promotes equity and leads to the best outcome for all of our patients.
It just simply wouldn't have been available or possible without Wisconsin Partnership Program.
What's special about this program is that we are able to match fellows with some of the pressing health concerns that these placement sites may have or are trying to address and tackle, but also ensure that we are building the next generation of public health leaders for the state.
That core funding can allow us to place fellows in organizations and in counties that really need a fellow the most, creating the conditions for all Wisconsin residents to thrive. The investment into the program will continue to help improve the conditions in Wisconsin for years to come because we're allowing folks to really become leaders and then be equipped to tackle the public health challenges that will face us ahead.
The partnership program very wisely has defined its mission broadly, so we support those basic scientific investigations that are going to lead to new discoveries that could then be leveraged in a more clinical and translational approach, bringing those discoveries into clinical care. And that's really what's very exciting about the partnership program broadly. It doesn't just pick out one area of the pipeline of research. It really spans across the entire breadth.
Many people don't know that diabetes is actually the leading cause of blindness in the United States among working-age adults. And yet 90% of that blindness is completely preventable using special cameras in the primary care clinic where people can get photographs taken of the back of their eye, and we can detect diabetic eye disease well before they have any symptoms and get them into care sooner. And this technology, even though it's really well known, hasn't really had good uptake. Why is it that these health systems are devoting so much time and effort into developing the program, and yet it doesn't get used? And we've partnered with different eye care doctors in the local community in Boston to provide care for patients, even those who are uninsured or have less insurance. So we've been able to provide care to a lot of people who wouldn't otherwise have access. What we do is really a reflection of the Wisconsin idea, where research from the university is used to improve the lives of the people of Wisconsin.
Antibiotic resistance is an ongoing and growing epidemic. The last new antibiotic that was discovered that we now use in patients was discovered in 1987. There hasn't been a new discovery that's made it to patients in the antibiotic realm. In fact, for the type of antimicrobial that we're working on, antifungals, there are only 3 types of therapies available.
One important feature of the partnership is that it's really valuable seed money to help us leverage additional money. That funding was instrumental in formulating a team of interdisciplinary scientists and physicians who work together across campus trying to develop new antibiotics. It's really a tremendous success story for the partnership and for the institution. And we feel that we're doing good work and trying to discover important antibiotics that will save lives.
There is no doubt that the Wisconsin Partnership Program actualizes our mission to serve the people of the state of Wisconsin. As we celebrate this 20th anniversary of the Wisconsin Partnership Program, I continue to be incredibly honored that we can move forward in step with our grantees in the domains of community, research, and education.
The Wisconsin Partnership Program is really the embodiment of the Wisconsin idea. We measure our success based on what we are doing for the people of the state. It's really about partnership, and the Wisconsin idea is about partnership. It's bringing together the experience of folks throughout the state, their insights, their dreams, their challenges, and then together coming up with tools to see if we can make life better. If you want to have a snapshot of what the Wisconsin idea is all about, then you should just take a picture of the Wisconsin Partnership Program.